Good afternoon. I'd like to introduce you to the new ABBA tribute band. -1.
Right.
You haven't heard me sing. Listen, thank you for staying. I know that there are lots of trains to catch, but this is the most important session, I think. Let me introduce you, and I don't know why I am introducing you, but to Dame Ruth May and to Sir Steve Powis. You know who they are, but they are going to discuss the NHS from their crucial roles leading England's medical and nursing professions. This is just an in-conversation, fireside chat. You can put some Q&As if you want to. I think there's some technology available. I've actually lost how they were going to do that. But if any of you have some questions, there's Slido. Yeah, do it on that. And we will just keep them quick fire because we have to be out of here at 10 past. So without any more ado, I am going to ask you, first of all, Ruth and Steve, much of your jobs, I think, are about visiting places around England. And I would just like you to give me some nice examples of where you've been, where you've thought, you know, this is how it should be working. This is good practice that should be spread.
Well, in the best traditions of starting by not answering the question that our journalist colleague has asked, the first thing I'd like to say is thank you for turning up. Because in the trick the organisers were taking here was to put us on at the end so you wouldn't go home. So for those of you that haven't gone home, thank you. It's really nice to see you all. But as Victoria said, people often ask me what the best bit of the job is. And the best bit of the job for me is really going out and doing the visits that I do all the time. And that's visits to lots of healthcare organisations, obviously hospitals, but general practice, pharmacy, dentistry, prisons, mental health, across the wide spectrum. It's a real privilege to go out and just see how healthcare is delivered throughout the NHS in places that, before I did this job, I probably never imagined were places where healthcare was delivered. So it's really fantastic. And what strikes me when I do those visits every time is despite all the pressures that the NHS is under, and it is under a lot of pressure at the moment, you all know that, what shines through is the dedication, the enthusiasm, the passion of the people I meet and talk to, the real desire to do the very best for the patients and the populations we serve, and to make things better and to continuously improve. And really, I always come away from visits uplifted by the experience. Often I'm seeing sometimes challenges where I've been on a visit previously where I've seen people with the same challenges who've got a solution. So part of what we do is say, you might want to contact this organisation because they've solved the problem that you have, and that's something that we can add in terms of the visits. But to give you an example, so as part of my personal objectives this year, I decided I would visit all the comprehensive stroke centres in the country where mechanical thrombectomy is undertaken. Mechanical thrombectomy, where you fish a clot out of an artery in the brain when it's the cause of a stroke, is a really transformative procedure. And those interventional neuroradiologists that do it will tell you that 1 minute you have somebody with a severe disability, and the next they're coming off the procedure table, and that disability is gone. They can talk again. They can move again. It really is, a transformative experience for the patient and for the clinician who's undertaking the procedure. We set an ambition in the long-term plan that 10% of stroke patients would have a mechanical thrombectomy. That's what the evidence base showed, and we're about halfway there. We were disrupted by the pandemic, but we've got more to do. So I decided this year to turbocharge it a bit. I'd visit all 24 centres, all in neuroscience centres, and 2 that are outside neuroscience centres that are developing services. I'm about halfway through. Started off in Plymouth, been all the way up to Newcastle. Tomorrow morning, I'll be in Salford. And again, same themes when I go. Real passion in those teams to strive for continuous improvement, to get the services up running 24/7 when they're not, to make sure that as many patients have access as quickly as possible. This is a time-critical procedure that requires the ambulance service. It requires peripheral stroke units who are referring into those comprehensive stroke centres to do the imaging quickly. We deployed AI, so there are programs that allow clinicians to see the images on their phone immediately and make snap decisions that this patient needs to be transferred. And all of that is critical because the faster you make the intervention, the less brain is damaged. So yeah, visits are great, and we do a lot of them.
I just heard about a very good urology service, actually, which has just cut the waiting list in Leicester. But that your example and the people I was talking to reminded me of one of the things that often comes up in the NHS is about spreading innovation, about spreading good practice. So something that's happening wonderfully in Leicester doesn't always make its way to Newcastle. Do you think that's getting better?
I think it is getting better, and of course we're passionate that it does get better. We've got programs such as NHS Impact that can help spread, and you know, one of the key functions of integrated care systems and integrated care boards is to spread that good practice. I was in session on patient safety this morning, and one of the things Aidan Fowler said, the National Patient Safety Director, is that we need to pay more attention to when things go well. Quite rightly, we pay a lot of attention to when things don't go well and they go wrong, but we need to spend as much time understanding why things do work and go well, ensuring that that best practice is spread. We can play a part in that, but frankly, everybody in the room can play a part in it.
Interesting. Ruth, let me put that question to you. What's impressed you?
Thank you. So I love doing the visits. It's visits that keeps my energy, keeps my mojo up, and I have huge respect for people that tell it as it is when we go on a visit. Don't lay the red carpet out. It's a conversation with people that tell it as it is. Because we want to hear it, what it's really like. And I'm really pleased that people do that. So I went to GSDT recently to see the Nursing Associates as we celebrated 5 years of Nursing Associates in England. And hearing their story of people that have been a healthcare support worker, nursing associate, and now a registered nurse. You know, we saw people, their careers, their lives has been enhanced by career development. And then there's, I was in Northampton, as the last session you might have heard with Aidan Fowler, seeing Martha's Rule in action, the call for concern. Hearing about some of the challenges about doing it. It's really tough in how they're going to do it in paediatrics, but how it made a difference. And how Jo, one of the ward sisters there, her and her daughter, both nurses, struggling about whether they would actually use it. So even when there's things that people are seeing that they're really doing well, they're telling us also, they're telling us the truth. They tell us right and proper what's working, what ain't working, what we should be doing about it. And then I was in Hull last week before? I was in Hull seeing their neonatal unit and maternity unit and seeing the money that we argue for around capital actually making a difference. So, and then this morning, 7:30 this morning, I'm saying this because I want to prove to people I was actually up on a neonatal unit with Duncan at 7:30 this morning, meeting the staff here in Manchester. A brilliant unit. With great staff, and the same as when we were in Hull. But what a difference it has when you've got the numbers of staff, the seniority of staff, and people working together. And, you know, that's what we've seen again today. The stories that come when people are working together, the partnerships together, that's when you think, yeah. And the other thing we saw this morning was a whole group of international nurses. A group of international nurses that were talking about their experience, how they're here and they're developing and they're training others, and how it's made a difference living in this country. So it gives us joy. It also gives us a list of actions to take away, and that's fine. That's our jobs, to hear it and to see it and to feel it.
It is very inspiring. I want to ask you something that's come through quite a lot in this conference. Steve, is the focus on prevention. I'm not allowed to ask you any political questions, but obviously prevention should be very high up the agenda. Is there anything you would like to see highlighted that could help people live longer, healthier lives?
Yes, so I think prevention has been something that has been a bit of a theme over the last couple of days. I chaired a session on it earlier this afternoon, which actually was a great session, not because of my chairing, but because of the great panels we had and the great discussion from the audience. And actually, I heard as people were leaving, going out the room, that people thought it was a really good session. So thank you for those that were there. So of course, it's not hard to convince people of the benefit of prevention. We learn very early on in medical school, in nursing school, in whatever school, that prevention is better than cure. Of course it is. And it is the case that ever since the NHS was founded, we have been trying to be a health service and not just an illness service. Obviously, preventing ill health is beneficial to the individual, it's beneficial to society, and it's beneficial to the health service in particular. So what is there not to like about prevention? But as I said earlier, if we've been trying to do it for almost 76 years, there's never a more pressing time to do it than now. And that's because of the demographic changes that Amanda alluded to in her speech yesterday, for really great reasons of improvements in society and in healthcare. People are living longer, and that means we have more of our population in those age brackets towards the end of life, when you tend to start getting disease, and you tend to start getting not one disease but multiple diseases. And we're going to see more of that because the population is aging. And so that is a pressing issue for us. The Chief Medical Officer laid it out in his recent report, and we need to find a way of dealing with that demand. And prevention is top of my list of dealing with that, because many of those illnesses are preventable. We know what the risk factors are, and they are modifiable. And of course, as I said earlier, it turns out that a lot of those conditions are also the conditions that are affecting those of working age who are out of work. So there's a sort of double win here, actually. Cardiovascular disease, respiratory disease, for instance. So I'm really passionate about that. We've got a whole range of programs within the NHS, from the long-term plan, digital weight management programs, diabetes prevention programs, smoking cessation programs that we have been rolling out and will continue to roll out. We've got a real focus on blood pressure control. We're doing well on atrial fibrillation detection and treatment, which is a risk factor for stroke. We have pretty much achieved what we wanted to do, so great work by everybody. Health innovation networks have really helped on that. So there's lots of good news, but of course there's more to be done. And of course it's not just the NHS, it's local government, it's national government. I'm not going to get political here, but of course the tobacco and vapes bill was a really important bill in the last Parliament. It didn't get through, but I note that the politicians in what they want to do in the next Parliament are putting that on the list. And so I think that from a clinical point of view, of course, it's something we want to do, because smoking is still the biggest cause of ill health. It is still the biggest cause of inequality. And of course, vaping is becoming a worry as well, and we are seeing admissions now because of vaping, so that's really important. But there's lots of innovation in this space, digital innovation. I've mentioned digital weight management programs. We have new drugs coming through, so a lot of press interest, of course, on weight loss drugs in obesity. Obesity is a real problem, as you all know. And there's good news there, because the evidence base that those drugs are leading to beneficial clinical outcomes is really growing. And I think the introduction of those drugs will mean we will have to relook at our obesity services and weight loss services across the whole range. Of course, medication is only one part of that. Healthy lifestyle, other measures are going to be really important as well. But these new weight loss drugs are going to be important parts of that approach. It does alarm me, though, when I hear reports that they are being inappropriately used. These are powerful medications that have side effects and complications, and can, in certain circumstances, be dangerous. So they need to be used under medical supervision. They are absolutely not quick fixes for those who are otherwise healthy, who just want to lose a few pounds.
Damn. But good health warning, yes, indeed. I hadn't thought about it at all.
Look, in terms of nursing, Victoria, it's really important, and prevention is the first P of my nursing 7 Ps, of my nursing strategy, because nurses and midwives and care workers have preventative conversations all of the time, and are really important. You talked about the smoking, vaping bill, really important, particularly for maternal health, but I can think of health visitors in particular, school nurses, have real big, important roles to play in supporting people on that preventative agenda. So the multi-professional approach to this is vital, and let's hope that the smoking bill does go through.
Well, you and I are both mothers of 14-year-olds.
Exactly.
And that would be the first group that would be impacted by it, because I was disheartened to go back to New Zealand and find they'd dropped the idea. So yes, fingers crossed, because I don't want my daughter to do what I did and smoke a lot. We
There's a lot
have
of peer pressure about vaping, though, isn't there? Lots of kids of our kids' age, they do vape. Now, my daughter tells me she's not going to do it. Let's wait and see. Like she told me she wasn't going to have a belly button pierced, but you know, let's wait and see.
This is getting a bit personal, Ruth, isn't it?
Exactly.
these things matter.
Have you not got one?
Yeah, and I mean, all within this conference.
You've never asked me that question before, have you?
That wasn't on the script.
I feel like I'm losing control.
Yes, sorry.
I mean, what has come up at this conference too, of course, within the prevention agenda is the health inequalities that need to be tackled, and the different way the ICSs can work in this area to work within a prevention agenda, dealing with their specific
Particularly in maternity. We know that Black, Asian, minority maternal health is different from that of a white woman. That can't be right in this day and age. Now, I know there's improvements being made, but it's not the right outcomes. And that's got to be, it's part of our 3-year delivery plan for maternity, something I'm really pleased is in there. But we now need to make sure that we continue to deliver improvements on that.
Yeah, well, we heard yesterday from 5 times more about that terrible disparity in maternal deaths. And they wanted some funding off you.
They did, and Duncan in the audience here was going to have a conversation with them. There's an action for you, Duncan.
So that health inequalities piece is really critical to all the work we do, and I'm sure all the work you do as well. The Core 20+5 program is really important. But we touched on inequalities earlier in the prevention session, and I said, not really in jest, but as an observation, a few people smiled at it, that I never visit an ICB or CCG before an ICB, where they don't tell me that they have the most deprived population in the country. Everybody has a bus journey or a train journey or some sort of journey that goes from the most deprived to least deprived. But the point of saying that is deprivation can be really, really localized, hyper-localized. So of course, everywhere in the country, even the parts of the country that we traditionally think of as being the least deprived, will have their pockets of deprivation. And the point of raising that is that the work that the ICBs are doing and need to do is really understanding population health and where those deprived areas and communities are, and making the targeted interventions in those communities. Andy Knox, who was on the panel, who's the Associate Medical Director in Lancashire and South Cumbria this morning, really gave great examples of how they're doing that in Barrow-in-Furness on smoking. So the targeted approaches in inequalities work. The lung cancer trucks that we've got out are beginning to mean that lung cancer, whereas all other cancers, early detection is much worse in the most deprived compared to the least deprived. That's been reversed in lung cancer. We're detecting lung cancer earlier in the most deprived because we are targeting an intervention exactly where it's needed. Inequalities, big focus of NHS England, big focus of ICBs, a lot more to do, not just across the things we've been talking about, but really targeted approaches work.
And better data collection has come up a lot too, real-time data. Okay, we have a lot of questions. Well, I have to take my glasses off to read. Ruth, okay, we know that you are sadly leaving. So the first question is, what advice would you give the incoming CNO? Don't do Twitter. Don't do Twitter.
X, formerly known as Twitter.
Yeah, right then, X. There's a serious side to that, to be honest, because X can be quite vicious sometimes. And sometimes it's amazing and it's brilliant to connect. I've loved being able to connect with frontline nurses, with patients, with families, and it's been great for that. But actually, sometimes people can be very, very, very vicious on it. So just be careful how you do social media. I guess my other big piece of advice is a bit of what Amanda was talking about yesterday, which was listening to patients, listening to families, listening to staff. And I know that those people that have made, those organisations that have made the most improvements and sustained improvements with maternity services are the ones that have listened to families and have put the families at the heart. So listening, and I suppose add the and actioning to that. And one final point, I guess, before I say what else I'd say to the new CNO, act with integrity. Always act with integrity. And sometimes in our positions, that's quite hard. It's quite hard. It's sometimes very hard. But act with integrity.
Why?
Why?
No, not why.
Why is it hard?
Why is it hard?
Why is it hard? If I just think back to the industrial action for nurses, really tough to do, and I know that lots of nurses made very personal, tough decisions as to whether to take industrial action or not. But I decided that I would go and visit nurses that weren't taking industrial action and those nurses on the picket line. And for me, that was important to be able to support all nurses.
And one more bit of advice, don't ask the National Medical Director in public about his belly button.
There's a question now I'm looking forward to answering.
Whichever one of you gets the job, just note that.
Yeah. So I can see these questions are being upvoted, so this one's just leapt to the top. But how can CNOs and CMOs champion the needs of the wider clinical workforce, that is pharmacists, AHPs, healthcare scientists who don't get a seat at the table? Steve?
Well, look, Ruth and I were really keen when ICBs were formed that we got as much clinical leadership onto the boards and top teams of ICBs as we could. Nurses, medical directors on there, but we're really keen that it doesn't stop there, and as much as possible, particularly ICBs, but not just ICBs, those other important professions are represented. The pharmacists, AHPs, and healthcare scientists sit in my directorate, and we have great chief professional officers who oversee those professions. And there are really great leaders in those professions. We have great leaders in our regional teams, and I know there are great leaders in local teams and ICBs and also in hospital trusts. As we expand what we do and into different healthcare settings such as pharmacies, in terms of primary care, prevention, stuff we've been talking about earlier, it's really important that we have strong leaders in those areas. And I know Sue Hill in science, Suzanne Rastrick in AHPs, David Webb in the pharmacy world, and I'd add dentistry to that as well, if you want to make the complete set. Jason Wong in dentistry are really working hard to ensure that they support local leaders, and that those local leaders are not just there, but they are impactful and they have a seat at the table. So we are, Ruth and I, obviously, we represent our own professions, but we really feel passionate about those other professions as well. And just because they're in my directorate, actually, Ruth is as passionate as I am. We're passionate about all these professions.
So if we learnt nothing else from the pandemic, it was about teamwork. And teamwork, I remember quite a few Sunday mornings working in my ITU in Colchester. And actually, it was the respiratory physio that I learnt loads from. It was the consultant acting as a healthcare support worker with me. If we learnt nothing else, it's about how we work as a team at all levels, and that's the important bit for me.
There are several NHS graduate management trainees in the room today. What is the one thing you wish you knew at the start of your leadership career, Ruth?
For me, and it's the biggest mistake I've ever made, and it was one that lived with me when I was at Frimley Park Hospital as a brand new H grade, I think it was, G grade, H grade, that dates me. But it's about looking for the informal leaders as well as the formal leaders. So whenever I go on to something new and go into a difficult issue or look at a project, I look for the people that not only are in those powerful positions, but actually the informal leaders, the leaders that are the people that convene, the people that are actually the decision makers or the influencers. I look for the informal leaders. So make sure you look out for those.
What would you say, Steve?
Well, I'm going to reframe that question a little bit, because I think it's about what have you have learned most over the course of your leadership career. Ruth answered part of the question for me, which is learn to listen and learn to take time to be with the public, with patients, with staff, and really listen to what they want to say and have to say. I think another thing for me is really learn early to see the world through the eyes of others. Having that ability to see the world through the lens of somebody else, whether that is a colleague, whether it's a patient, which of course is what primarily as clinicians we need to do, whether it's a politician, understand why they are coming at an issue in the way they're coming at, and that will help you together solve something that you want to solve. Another way of saying, other people's views are important. Understanding why they have those views is a real key part of leadership.
So the next question is, what's the best leadership advice you've had in your career and why? Does that follow on from, is that part of it?
Well, what can I say on that one? Well, I sometimes, when I was a very young junior doctor, I remember the job that influenced me most was the renal unit at Guy's Hospital, which is partly why I went into renal medicine, but also in retrospect, partly why I went into leadership. And the reason for that was that it was a really, at the time, this is in the 80s, a really go-ahead, multi-professional, multidisciplinary team. My first instruction when I get there was to do whatever the nurses said, just do it.
He still follows that now?
Yeah, which I've followed for most of my career. But that, that instilling for me at a very early age of the power of multi-professional, multidisciplinary team working in a unit that actually was ahead of the curve in doing that, really instilled that in me. And it was only when I looked back later that I began to realize quite how influential it had been. And sometimes you don't realize what the influences are until you look back and you think, that's why I've turned out the way I've turned out. That was the thing that changed me, although you might not realize it at the time.
What would you say?
For me, it would be you're only as good as your team. So invest in your team, invest in your relationships with your colleagues, and that's why teamwork is so important. So invest in your relationships, sidewards, but particularly also you're only as good as your team.
Do you have mentors?
I mentor him.
Look how I turned out.
Yes, I do. Yes, I do. And I was very, very grateful for my mentor, particularly during the pandemic, when I was able to talk to them in an honest way, in a frustrated way sometimes, in an emotional way sometimes, but somebody that was able to stand by me and also to lift me when I needed to be lifted. So yes, I have a mentor and I'm very grateful for them.
I don't have a formal mentor, although over my career there are people who I consider have given me mentorship and who I think are most influential. But I think the point that Ruth makes, which is true for us in our positions as it is true for all of you and anybody in any position, is that we rely really heavily on a network of colleagues who we see as in a sense are a team. And I'm not just talking about colleagues in NHS England. For me, it's Chris Whitty at DHSC, it's Susan Hopkins, who I've known for ages at UXA, Jenny Harris, and for Ruth, it's some of those, but other people as well. So we have a team of people who understand the roles that we do and the difficulties. And part of what we do, part of my job as well, and Ruth's job, is to provide that support to others and to seek support from them as well when we need it. Because there's no matter where you are in the health service, and at whatever role, whatever level, you will have tough days. And getting through those tough days relies on having that network of support. We're no different. We have that network of support. And particularly during the pandemic, it was incredibly important, and it still is important.
And Andrea Sutcliffe, sat in the front row here, was part of my support.
Some of those people are in the audience, and just having the ability to pick up the phone and say, firstly, I need some help here, I have a tough time, but also pick up the phone and say, I know you're having a tough time. Is there anything I can do to help? It's really important.
No, I think so, and it's one of those things that you suddenly only think about sometimes at the end, or when you're so far into your career and you think, actually, that person got me through this particular moment. Look, we've run out of time for the questions, but I do want to just read this one here, which says, not a question, but just want to say thank you, Ruth, for the commitment to tackling racism in the NHS. You have empowered staff from global majority to develop.
So can I just call out some guys in the front row here somewhere? The Jabali Network. So they're amazing. They started February 2020. There was 9 of them in a room. It was actually your office. We had to clear it up. But we went into, it was his office, wasn't it? We went into your office, moved all your paperwork. This was just before the pandemic.
Was in your office.
Yeah, that was before the pandemic. It was, this is a group of black men in nursing. There was 9 of them, and we got together to support each other, and they are now over 100 of senior men in nursing from a global majority, and they're networking, they're supporting each other. They are doing an amazing job. The Jabali Network. They're brilliant.
I have been told to keep very strictly to time, so I'm slightly racing through this, although one of the questions I have on the list you have actually been asked already, but you did announce your retirement this year. I think there are many people who are sad to see you go, but can you just tell me what you are most proud of as you start on the next stage of your life?
Well, I guess I'm really proud of the 60,000 extra nurses we've got now in the NHS. So if I think about September 2019, there was a commitment to have 50,000 additional nurses. We bust that. We got 62,000 extra nurses now in the NHS. And that makes a difference. And you know what? The international nurses have been a very welcome addition. So we were welcoming about 6,000 internationally educated nurses every year. And now we're welcoming, just this last year, over 20,000 in a year. So they are great. My ask of you all is to look after them. Look after them. And I think the Jabali Network as well. They're amazing.
Well, you did talk about some of this, but do you have any more advice for your successor?
Oh, it's a great privilege to do this job. Huge privilege. Have fun. Look after yourself while you're doing it. And make a difference.
That's... Yeah. We are coming to the end of the session, and I know you've all got to get home, but I just wondered, Steve, if there was something you wanted to say.
Yeah, I do want to say something, because we have started to touch on it, but Ruth, this is your last ConfedExpo. And you have, I think you can hear and see the warmth of feeling that people have towards you. So 40 years in the NHS, starting in Frimley. Many years ago. Lots of jobs, regional jobs, lots of different region, NHS improvement, 5 years.
This was not on the script?
5 years. No, it wasn't on the script. Your version of the script didn't have this on it. 5 years as chief nurse. So you should be incredibly proud of all the stuff that you have done. Some of that has been very visible. I was going to talk about the 50,000. I was going to talk about the 50,000 new nurse program, but it's 60,000, as she said. So you've gone and exceeded that. But the support you've given to the profession, to communities within the profession, the Windrush community. I mean, I go to Windrush events with you every year, and I know how passionate you feel. International nurses, you've mentioned the programs that Ruth runs at NHS England, children's and young people, maternity. I can't tell you how passionate she is about those and how much she speaks up for those groups, those populations, whenever she has the opportunity, how hard she fights for the resource and the attention that they quite rightly deserve. But I also, your leadership during the pandemic, you were the professional lead for nurses, for midwives. I know you got your colleagues through the pandemic. You were either on the front line or you were supporting them in so many ways. But I also see all the things that you don't see in the background, all the stuff that Ruth does for patients, for nurses, for all NHS staff in the background, how hard she fights, how hard she ensures that she always has that North Star and is always doing the right thing. So you have been absolutely tremendous over the last 5 years. You will have seen some of the banter, and Ruth and I have lots of banter. Our offices are next door. We work incredibly closely together. I will really miss you personally because it's been a super 5 years. It's gone by incredibly quickly. But just to say on behalf of, well, personally on behalf of me, just a huge thanks for all the support you've given. On behalf of NHS England, there'll be other opportunities, but a huge thanks. But on behalf of everybody, you have been an outstanding chief nurse. We will miss you. You're going to be a hard act to follow, set of shoes to get into, maybe not those ones, but it's going to be a difficult act to follow. And we have some flowers for you.
Mm-hmm.
There you are.
Thank you. Thank you.
And it says here, at the end of the bit you didn't get, Ruth may want to say some final words. Ruth is not aware of this part.
Oh, gosh. It's a huge privilege. Thank you. I wasn't expecting that. And you've even cried. You're not allowed
I cry
to
at
do
anything. But I particularly cry now.
Yeah.
Oh,
Thank you.
Can you say thank you once more? Thank you for your time.
Thank you. Are you done?
Yeah.
Oh, that's nice.